Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery, and I get to answer your questions. And this month of October, we have a special topic, which is very popular in our platforms because of the popularity of the procedure, and because we do a fair amount of this procedures. And we're going to be talking all month about cakes. So if you saw our stories yesterday, we were all our Dr. Wiggerib, Dr. Earl, me, all the staff, we're choosing our perfect cakes. And what is our perfect cake? So why cakes? Because we're going to be talking about the cake bud. So we are going to be talking about the layers of the cake, and we are going to start this month topic with the most important aspect of cooking this cake, which is cooking the cake safely, okay? We don't want it to burn. We don't want it to destroy the cake. We want to enhance the cake, but keep it safe, okay? And I think that's one of the main reasons this procedure has had so bad promotion popularity. And it's because the unsafe practices that unfortunately we have seen this procedure. So there's still some misinformation regarding the safety profile of this procedure, thinking that it is still unsafe to do, and it is unsafe to do under certain circumstances, and I'll go over that. So first and foremost, I am going to start getting the elephant out of the room. We're talking about ultrasound guided BBL. And why is this so important? So let's start a little bit about the anatomy of the buttock region. The anatomy of this region is very, very different, and we do in plastic surgery fat transfers to other areas of the body, the face, the breast, multiple areas. In burn, we do it a lot for scar treatments. So this is the fat transferring fat from one area of the body to the other. It's not something new. Plastic surgeons have been doing this for years, 50, 60 years. But what's the problem with the buttock fat transfer? The vessels that are in our pelvic region are large. So the vessels, the veins and arteries that go to our buttock are very, very large and drain directly to our pelvis, which is a straight towards your cava, which is the largest vein in our body that drains to our heart. And what is the problem with this area? The valves and the connection of these veins, okay? And also, the pressure differences that are in our pelvis are very different of the other areas that we commonly inject fat, which is the breast, which has very little blood supply, especially larger veins like in the pelvis. And in the face we have a lot of blood supply, but not large vessels like in the pelvis. So what happened initially? So initially, surgeons were injecting literally in the muscle. Why? Because the muscle has good blood supply, and we need good blood supply for the fat to transfer and to survive. So the concept was we can expand it more, and the viability or the fat that survives there, it's better. So they were seeing very drastic results with just one round of a BBL. And everybody was happy with that. But what happened when you do a lot of numbers of this, and this is important to understand that this is not a common, the fat embolism is not common after BBL, but when you do large numbers of these procedures, we started seeing these cases. Mortalities after BBL. And if you Google BBL and the complications, you'll probably see a bunch of articles about this. So what is the problem? When you're injecting fat in the muscle, it goes directly to those veins, travels to your lungs, and it obstructs the circulation of the lungs. And that's what causes a fat embolism, okay? Fat embolism occurs in the operating room or within a few hours after. This is not something that you're gonna see after you go home in 3 to 4 days. No, fat embolism is something that happens quick in the operating room or within 2 to 3 hours after the procedure, okay? And if it happens, you're going to notice, the surgeon is going to notice right away, because it decreases the oxygenation, and you're going to see changes in the blood pressure, the heart rate immediately, okay? So surgeons starting to get together. It's like, what is it that we're doing that is causing this? So there was a big meeting of surgeons, and actually because South Florida, unfortunately, we were doing a lot of this BBL procedures. A lot of surgeons from South Florida, and I trained at the University of Miami, so I had the privilege to train under Dr. Garcia, Dr. Pismino, which were the ones that were going and doing the autopsies and checking what was going on with these patients, and that's what they saw. The most important thing that they saw in these studies is that it is safe to inject in the subcutaneous space. So fat embolism happens when you inject in the muscle. So no injection in the muscle, just in the subcutaneous space. It doesn't travel as fat embolism, and it doesn't have that risk. So then the societies, the American Society of Plastic Surgeons, the American Society of Aesthetic Plastic Surgeons issued, and in the International Society as well, issued statements saying all surgeons should just inject in the subcutaneous space. And the Florida Department of Health and everyone's like on board. We're just injecting in the subcutaneous space so this doesn't happen. What happened? It continued to happen. Why? Because surgeons were doing it blindly. When you're injecting the cannula and you're not seeing, you may think that you're injecting in the muscle, but you're not seeing. And that's where the ultrasound comes in. Ultrasound is a device that you put in the skin, and the ultrasound is what we use to look at the babies. So it's very safe to use, and we can see different layers. And that's why we see the babies when you're pregnant. So we can see it live. If we put the probe here in the skin, we can see the different layers. We can see the skin, the muscle, and the fascia, which is what divides the fat and the muscle. And live, I can see my cannula, confirm that I'm in this space, and while I'm injecting, I'm seeing the fat fill in here and nothing going in the muscle. This is the only way that a BBL should be done. So this is something very, very important to ask your surgeon. Do you use an ultrasound? How experienced you are with an ultrasound? So you make sure that this surgery is done safely. Doing this surgery is safer than a tummy tuck. And a tummy tuck is a very safe surgery that we've been doing for years. So if you do it safely, BBL shouldn't be a gamble or a very risky surgery that you can end up losing your life. That is not what it's all about, right? Like, you need to confirm visually where you are, making sure that you're injecting in the safe space, right? And I do this with every single BBL I've done in my career because, like I mentioned, I trained at the University of Miami. So I was training with the surgeons that did those studies, and they were always doing BBLs with ultrasound guidance. And when I joined Pure in 2021, I trained again with Dr. Earl, which was doing ultrasound guided BBLs since 2019. So every single BBL I have done at Pure has done under ultrasound guidance, and I do it with every single BBL, okay? So, and that's the importance of it. The other two things that I want to focus on is not only the use of ultrasound, but the surgeon's experience and certification, and the center's certification. And I'll go over a little bit about why this is important. Your surgeon's experience is extremely important, but also their training, okay? And I'll put this as an example. If you have a brain tumor and you need the brain tumor to be removed, you go to a surgeon that does this, right? You go to a neurosurgeon that has training in brain surgery. You don't go to another type of surgeon that has done some brain tumors. No, you go to a specialist. And that's for me, Most important thing with liposuction. So people think liposuction is not a surgical procedure, and that's the first mistake. Liposuction is surgery. So you need to go with a surgeon that was trained to do that, okay? So it's important that you check that your surgeon is certified, and by what? By the American Board of Plastic Surgery, okay? That ensures that your surgeon did a focused training in plastic surgery that can be, like I did it, after general surgery, and that's why I am double board certified, because I am certified in general surgery by the American Board of Surgery, which is a 5-year general surgery residency, and then you take your boards, which is a written and an oral. And then I did a year of burns, which was extra for me. And then, because I'm like that, and then I did 3 years of focused plastic and reconstructive surgery. After that is when I took my written exam for the American Board of Plastic Surgery boards. I was already certified by the American Board of Surgery, and the oral exam. So all of this ensures not only that you have all the numbers to graduate, to certify that you are experienced, but also well trained in doing the certain procedures, but also that you are number one in safety, and also you are ethical and moral with your patients. And all of that is looked into by the American Board of Plastic Surgery, okay? So it is very, very important and to discuss this in your consultation with your surgeon. And for the center, because you can't have a surgeon that is board certified by the American Board of Plastic Surgery, but if they practice in a center that doesn't have the standards of ultrasound guided imaging, they have not only you have to be sure to how to use the ultrasound, but you need a good ultrasound machine, you need good equipment in order to give the best results. And that's why here at Pure, that's so important to us. And here at Pure, we're an office-based surgical facility. What does that mean? It means I don't work in a hospital. I work here. My operating rooms are here at Pure. And for that, you should, centers here in the state of Florida can have a certification by the Department of Health. But we took it extra steps, not only from the Department of Health, we took an accreditation by JCO. It's a joint commission that accredits hospitals. So we are accredited by JCO. And what does that mean? Is the higher standards on patient safety, compliance, and all the regulations as a hospital level facility. So we are JCO certified since I think it was 2020 or 2019, the first one. We recertified last year, so we are up to date in our recertifications, and this is every 2 to 3 years, okay? So we keep on that certification and visits constantly to maintain that certification, okay? And 2 other things that are very important in terms of complications of BBL, you know, the fat embolism is the number 1, and we take it with ultrasound, but the other 2 things that you should consider are infections. So ask for the percent of infections, because when we're injecting fat in the butt, that fat can get infected because it's not a very clean area. So it is important to ask that. So JCO certification certifies that we have the highest standards on sterility and maintaining our equipment, but also our infectious rate here at Pure, we do this every year. We take our numbers at the end of the year, so you'll see that live in December. We always go through our numbers, how many BBLs we did, how many infections, and everything in detail. Our last year's was less than 1%, so we are very strict with our infectious protocols here to avoid infections. It's never 0, because infections happen. We are a human body, right? But it's important that the center you decide has a very high standard, so they're very low. The national average on BBL infections is around 6 to 10%. So this is very low compared to nationwide and worldwide. And bleeding is the other one that can happen after liposuction, okay? So that's why I ask all my patients to start iron supplements, vitamin C, folic acid supplements 30 days before surgery, and then for at least 2 weeks after, to try to maintain those levels, and your hemoglobin levels should be 12 or more. Okay. Let's get some questions.
Yes, we have a few here already. Okay. Yes. First one. With ultrasound guide, I've been wanting to add fat to my laterals to give a more smoother blend from my buttocks to legs. Is this something that you are familiar with repairing? So I guess she had a BBL.
You had a BBL. Definitely. I do a lot of revision BBLs, reversal BBLs, and shaping and adding to the hip area is something that we can. The important thing to evaluate in your case is how much fat you have available, right? Because to fill in the hip dips, to round your curves, we need fat. So sometimes after a first round BBL, that's the tricky part. So I sometimes recommend either gaining a little bit of weight to add some fat or adding other areas that weren't lipo in the first round, like the arms or the legs, to get more fat for your goals.
Okay. The ultrasound is something add-on?
No, it is included in all BBLs. I never do a BBL without the ultrasound. So if you're getting a quote for a BBL with me, it is included.
Okay. The same patient of the question before of the ultrasound. She asked if there is a fee of having a consultation with you, but maybe we can explain the process.
Yeah,
quickly.
Very good. So basically, if you go to our website, pureplasticsurgery.com, there's a link for virtual consultation. That's a form that will ask you a couple of questions, send pictures. That is completely free. So that doesn't have any cost. You send that in, and I give you my recommendation. You get a call from a coordinator explaining my recommendation for the procedure that you're asking for. If you want to add a virtual consultation or an in-house to come in person, then there are some fees and your coordinator can help you with that. But even if you want to come in person, the first step is the virtual consultation to make sure that you're a candidate. So when you come, everything is prepared for you.
Okay. Please, can you explain how to sit and sleep after the BBL first weeks?
Very good question. So
sleep.
Yeah. Very good question. So how to sleep in your belly. So if you are not a stomach or a belly sleeper and you're a back sleeper, my advice is start practicing with a lot of pillows. Try to get comfort in the position. But yes, it is very important that you don't put pressure to the fat transferred areas for 6 weeks. Why? When I inject in the subcutaneous space, like I mentioned, there's not as a robust or big blood supply like we have it in the muscle, but we know it is not safe to inject in the muscle. It is safe to inject in the subcutaneous space. So that means that basically you are transferring like seeds from one area to another pot, but that area needs to grow its new roots, okay? While it's growing the new roots, if you put pressure on those seeds, they're not gonna grow, they're gonna die. So that's basically what happens to the fat if you start sitting or sleeping in your back too early. We want those roots, which are the new blood vessels, to grow. Once those roots are there, then you can start applying pressure because that blood supply is already established, okay? So sleeping in your belly, you're gonna use your knees and your elbows a lot to rest. And there is something called a BBL pillow. A BBL pillow is a rectangular pillow that you put under your thighs, so when you're sitting, your pressure is on the thighs and not the butt. And that way you can sit for the first 6 weeks.
En español.
Todo esto.
No, la pregunta que viene. ¿Todavía el doctor usando el ultrasonido puede tener el paciente una embolia?
No, si está observando la inyección. O sea, lo importante es que no utilice el ultrasonido, mire, ponga el ultrasonido y empiece a inyectar. Yo utilizo el ultrasonido durante la inyección para asegurarme que cuando yo esté inyectando no vaya al músculo.
Ok. Otra en español y la pregunta es por los senos. ¿Por qué la cicatriz de ancla la necesito para el levantamiento?
Mira, hay un live que me voy bien en detalle de la diferencia de las cicatrices dependiendo de cuánto se llama ptosis, el término médico de cuán caído está el seno, ¿ok? Si te recomendé el ancla es porque el grado de caída es que tu pezón y areola están al nivel del pliegue inframamario. Cuando es de esa manera, ya hay mucha caída del seno y poniendo un implante solamente no se va a resolver, actually se ve peor, porque el implante o se ve muy arriba y el seno abajo, así que no empatan, o el implante se cae y entonces no tienes ningún cleavage o volumen en el pecho y todo es bien caído. Así que esa es la recomendación, pero hay un live específico, si lo buscas en mi página, de levantamiento de senos y te explico en detalle las medidas y cuántos centímetros dependiendo de la cicatriz. Okay, you guys, thank you so much for all the questions. This is the beginning of the cake topic for the entire month. So this is just the first ingredients of the cake making process. Next week we'll continue with this cake class, so don't miss it. I'll see you guys next week. Take care.